It's early morning as Michelle Messer and her four-legged friend Hunter arrive for their work shift, sporting their matching vests and official name badges. This dynamic duo is ready to hit the ground running. Okay, politely walking on a leash, no running allowed. To greet patients and offer a comforting word or paw to patients. Michelle and Hunter are a volunteer team, part of the popular Paws Force pet therapy program here at Mayo Clinic Health System.
There are many reasons why I volunteer at Mayo Clinic, but probably the most important one to me is because they saved my life, and I wanted to give something back to Mayo Clinic.
Michelle is living with stage 4 ovarian cancer. Years ago, when she was first diagnosed, her odds of surviving even a few months were incredibly slim. She's undergone grueling surgeries and chemo twice. She's still here at the hospital and clinic, no longer as a chemotherapy patient, but as an active volunteer.
I also volunteer because me being a past chemo patient, I'm able to give hope to other patients. And I see the joy when they see the dog, and that brings me joy. Whenever I walk into the waiting room or walk up to a chair, it's an instant smile. So bringing that joy to people it fills me up. It just fills me up and it fills them up. And a smile can be so simple. I mean, it's just such a simple thing, but it just changes everybody's outlook.
A lot of our volunteers are either former patients or family of patients that come back and want to give back something.
Jennifer Lowe, Volunteer Services Director at Mayo Clinic Health System, says volunteers like Michelle are inspiring.
Biggest thing about Michelle is just her incredible positive attitude and her outlook on life and her fight to be here, her fight to be involved and stay involved. And it's just inspirational. That's, it's like, who do you want to be when you grow up? Or, if you're tagged with something bad, if a rough diagnosis, that's who I want to be. I want to be the fighter.
Lowe admits it takes an army of volunteers to make this healthcare community thrive. Each year, more than 700 volunteers support Mayo Clinic Health System in Northwest Wisconsin, and more are always welcome and needed. There's room for everyone, from high school students to retirees.
Some of the more widely known are step force, where they're transporting and escorting patients from the hospital and clinic, but other areas like our critical care waiting area, where you're in the back working mostly with the families and communicating with them, helping them get a warm blanket, making warm coffee, fresh coffee, or maybe making coffee for the staff because that's what they need. Another place is our patient companion, where we have volunteers that are going to visit our palliative care patients and just hanging out, having conversations, maybe playing a game or reading a book or writing a letter to somebody if that's what they need. Gift shop volunteers, information desks. Almost all of our information desks are staffed by volunteers.
In case you were wondering about the numbers, Lowe says Mayo Clinic Health System volunteers contribute roughly 80,000 hours of service annually. That's the equivalent of nearly 40 full-time employees. A true gift whose value is priceless.
Treating them like they are a treasure is so important. So important to build the program, and so important then so they can share that treasure with our patients, with our staff, with our families.
I think volunteering is a win-win because it's really good for me because I'm not working now, to get out in the public and do something that's helping somebody else. So when you're helping somebody else, you feel better. So it's helping my health as well as it's helping theirs.
For more information about becoming a Mayo Clinic Health System volunteer, please call the number on the screen or go to mayoclinichealthsystem.org to learn more.